Welcome to this video on Master Therapeutic Duplication, designed as a pharmacy technician exam prep for PTCB 2026 certification. We will cover exam tips, tricks, traps, and practice questions to help you master this critical topic. Therapeutic duplication is a key focus on the exam, making up 35% of the medications domain. Expect scenario-based, multiple-choice questions requiring you to identify true duplicates, brand versus generic, and different strengths. Understanding FDA equivalence ratings is crucial. A-rated codes like A, B, and AT confirm therapeutic equivalence and allow substitution. B-rated codes signal non-equivalence. These are not substitutable. When a due or warning occurs, cross-reference the NDC and rating. For B-rated or ambiguous codes, escalate to the pharmacist. Watch out for common traps. Trap 1. Same active ingredient with different salts are not duplicates. Trap 2. Combination products have multiple active ingredients. Trap 3. Duplicate therapy across prescription and OTC medications must be flagged. Trap 4. Different strength units need careful verification. Memorize high-frequency equivalences to save time on the exam. Linking brand to generic suffixes can save 20 to 30 seconds per exam item. Some examples include Lipitor to atorvastatin and Zestrel to lisinopril. When analyzing equivalence, remember the active moiety rule. Always compare the active moiety name, not the full salt title, when judging duplication. For example, alendronate sodium and alendronate are equivalent, while clopidogrel bisulfate and hydrogen sulfate are not interchangeable due to bioavailability differences. Strength matching is key for therapeutic duplication. If a new prescription strength differs from the patient's profile, it is typically a distinct product, not a duplicate. Always alert the pharmacist to check for prescriber intent, such as titration or error. Dosage form and route matter. A metformin oral tablet and an oral solution are not duplicates, as different dosage forms are distinct. Be vigilant for route keywords like PO, topical, or ophthalmic on the exam. Avoid the combo product trap. Lisinopril hydrochlorothiazide is not a duplicate of lisinopril alone because it contains different active ingredients. Always identify and compare both ingredients against the patient's history. To resolve reject codes 78, duplicate therapy, and 22, missing W, follow a specific workflow. Use Orange Book data for generic equivalence. Apply DAW0, document pharmacist approval, and resubmit the claim. Mastering this workflow prevents delays and helps secure points on process questions. Here is a practice question. Which is the generic equivalent of Crestor 10 milligrams? The correct answer is rosuvastatin 10 milligrams. Rosuvastatin is the active moiety and is A-rated for substitution. Memorizing brand to generic maps is a quick study pearl. Another practice question. Is alendronate sodium 70 milligrams a therapeutic duplicate of alendronate 70 milligrams? Yes, because sodium is a salt counter-ion that dissociates in vivo. Avoid overthinking the salt name when it does not alter bioavailability. Let's consider dose change versus duplication. If a profile shows atorvastatin 20 milligrams yesterday and a new prescription is for 40 milligrams today, it is not a duplication. The strengths differ, representing a dose increase. Always verify and document intentional dose titrations with the pharmacist. Is losartan 50 milligrams a duplicate of Hyzar 50 to 12.5? The answer is no. Hyzar contains hydrochlorothiazide as a second ingredient. Always scan for identifiers like HCTZ to catch combo product twists. Is timolol ophthalmic 0.5% a therapeutic duplication of timolol 5 milligrams POBID? No. Different routes, ophthalmic versus oral, often mean different therapeutic indications, such as glaucoma treatment versus hypertension management. If a patient has an RX for an naproxen 500 milligrams and buys OTC Aleve 220 milligrams, is this duplicate therapy? Yes. The same active ingredient naproxen is involved. The cumulative NSAID dose increases the GI bleed risk, so you must alert the pharmacist. Is clopidogrel hydrogen sulfate 75 milligrams a duplicate of clopidogrel besylate 75 milligrams? No, the FDA has not rated these salts as therapeutically equivalent due to different dissolution profiles. Focus on FDA ratings and salt form specificity in duplications. Is adalimumab biosimilar Amjevita a duplicate of Humira? No, biosimilars are distinct products, not simple generic equivalents. They require special designation and a technician should never substitute without pharmacist confirmation and compliance with state substitution laws. Metoprolol tartrate 50 mg is a B-rated to low pressor. Is it substitutable? Yes. The AB code means established bioequivalence. The technician can proceed with generic substitution unless DAW1 is written. Knowing rating letters saves time on the exam. Is a diltiazem 120 mg capsule a duplicate of a diltiazem 120 mg tablet? No. They have different release mechanisms, such as extended or immediate release. Incorrect substitution alters pharmacokinetics, so verify suffixes and formulation carefully. This marks the end of our structured review on therapeutic duplication. We've covered critical concepts for the PTCB exam. Remember to review the key distinctions between A-rated and B-rated products. Focus on the active moiety rule when comparing different salt forms. Always verify strength and dosage form to avoid common duplication traps. Be prepared to handle combination products and understand why they are not simple duplicates. Practice the workflow for handling common reject codes 78 and 22 effectively. Review the high-frequency brand-to-generic equivalences for quicker recall during the exam. Understanding routes of administration is essential, as different routes can change the therapeutic indication. Continue practicing with scenario questions to solidify your understanding of therapeutic duplication. Thank you for watching this video. We wish you the best of luck with your PTCB 2026 certification exam preparations.